Hi, today I'm going to be demonstrating on how to change a wound dressing. The first thing you're going to do, if necessary, medicate the patient 20 to 30 minutes prior to changing the wound dressing. Next, you're going to assemble all of your supplies, which may include primary and secondary dressings, a syringe, saline solution or wound cleanser, a paper towel, 2 pairs of gloves, and also a plastic bag for disposal of the soiled dressings. After you put your gloves on, now you're ready for the removal of the dressing. This is the secondary dressing. Now what you want to do is you want to pull back on the skin and gently remove the dressing. You want to be very gentle with this. Now if it gets stuck on any region of the skin, you could put saline solution or the wound cleanser on a clean gauze and dab it around to break or loosen the adhesive bonds. All right. Once you have taken this off, it's now ready for disposal. Okay. And also, this is the primary dressing, and you're going to carefully take it out. Now again, if it gets stuck, you can pour saline solution on to loosen the bond. Alright, now you're going to dispose of this. Alright, now the wound is ready for cleansing. Now that you have removed the dressing, you are now ready to prep the wound. The first thing you want to do is take off your gloves like so and dispose of them. Once you have done this, now get your drape ready, which can also be a paper towel. You have your primary and your secondary dressings. Open them up and place them upon the paper towel. And now we're ready to prepare the wound. We have our primary and secondary dressing upon the paper towel, and now we're going to put on our gloves. Now that you have put on the gloves, you're ready for cleansing the wound. Now, there are 2 parts of this process that you can do. You can either use the saline solution and take the syringe and irrigate gently the wound. And as an alternative of that, you could also use the wound cleanser. And what you want to do is you want to spray it by using your gauze as a protectant. Alright, and now you're ready to cleanse the wound. By doing this, you're going to do it in a spiral or circular motion, non-linear, and gently cleanse the wound. And you're also going to dab on the outside of the wound, which is the peri wound, to also clean that too. Now that you have cleansed the wound, you are now ready to inspect the wound. A good idea of this is to take a picture of it and show to your healthcare professional. Now also, if the wound has any pale, bloody, black or yellow, this may be a problem, and this is something you should speak to your healthcare professional about. Now we are ready to apply our dressings. We're going to take our primary dressing and gently put it inside the wound. And you don't want to pack it tight, but you want to make sure that there is no dead space. Gently put that in there and sit it upon the wound. Now that we have done that, we're ready to take the secondary dressing. And you want to put it you want to make sure that your dressing is at least 1 inch away from the edge of the wound, so the adhesive part is not touching the wound. Once you have applied your dressing, you want to keep in mind that it is a good idea to periodically inspect your wound dressing to make sure that it is intact and that there is no seepage coming through. To learn more, go to CoreCareNJ.com.